I'm Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, we are discussing something that is such an important topic right now. We are discussing the uprise in violence against Asian Americans and the devastation on mental health in the Asian American community. And I have here with me today, it's my honor and privilege to interview Dr. Rona Hu. Welcome to our show.
Thank you so much. I often start talks by saying that it's a pleasure and an honor to be on these talks. And I can't say it's an entire pleasure to be on a podcast about anti-Asian violence because it's not a pleasure that is needed. And yet it's an honor to be able to do something about it. And that's what I hope we're able to do today.
Absolutely. Thank you so much. My first question for you is, can you start by sharing with us a little bit about mental health challenges in Asian Americans?
Yes, definitely. And I think today we'll talk a little bit about the mental health challenges even before the recent uprise in violence and discrimination. But I'll start with an anecdote of my own, a personal example, which was when I was a third-year medical student rotating through OBGYN. On my first day, an obstetrics resident, male, white, told me that Asian women feel less pain. And I thought, that is news to me. And this was in a hospital where there were lots and lots of Asian women, specifically mostly Chinese, but also Vietnamese and some Korean women. The very next Chinese mom who went into labor went, and the resident said, "What's that tongue clicking thing they always do?" And I said, "That's pain." And at the time, since I was a medical student, I didn't say anything further. Maybe I did enough consciousness raising just by identifying for him. Even now, when I think back on it, I think of all the women with tears and labor, all of the pain of that, and who weren't getting sufficient pain medication or even having it addressed because of the assumption that Asian women felt less pain. And the resident wasn't evil. He was maybe ignorant, but ignorance has a cure, right? Ignorance can be dealt with education. And then one wonders when someone is othered by something that profound, the whole idea that someone would feel less pain. And this has come up historically for other groups of marginalized people as well. Blacks. There was a survey, Seema Yasmin has in her book of poetry, a survey of white physicians and medical students and what proportion of them thought that blacks had thicker skin or felt less pain. So this is not unique to Asian women. And so reflecting on that, just this one incident had so many, I think, profound implications for what someone might think about people being other or less human on some level. There's the education that needs to happen with all of us. But then also as an Asian woman, I also flash forward years later when I became a mom. And as I was about to go into labor and delivery, my own mom said to me 10,000 times, "Don't shout." So in Chinese, it's 千万不要, 10,000 times don't. So it's like 千万不要 shout, 千万不要, wiggle around, and which is something that goes very far back in Asian culture. Now, I was having a 9.5-pound baby, so I banned my mom. I banned my mom from the delivery rooms. You can see the baby after she comes out. I don't want anybody like that in the delivery room with me. But so some of what I want to talk about today is what we can all do from various communities, from people who are Asian, people who are not Asian. And I think one of the things that we all need to do is speak our voices, speak our truths, and then also for people to hear our voices and So speak up, speak out, be allies. And that's something that I very much want to talk about. The mental health challenges going far back include this stoicism and the different expressions of pain. So yes, we do, I can tell you, feel pain. Everybody else feels pain. But we're often taught from an early age that we're not supposed to say anything. There's research going back decades that we are 1/4 as likely to seek mental health treatment. So if you think about that, mental health services are probably already underutilized. And then if you think that 3/4 of the people who probably should have gotten it are not getting it. And then we're more likely to drop out early. There's a stronger sense of stigma around mental health issues. And so accessing mental health, we definitely underutilize that. I also have noticed, and my colleagues have noticed as well, that the family history is almost always negative. So when I talk to a family and ask for a history of, say, mania, some of my colleagues at Stanford, Terry Ketter and Kiki Chang, noticed that the rate of bipolar among Asians was the same as everyone else, but the rate of family history was practically zero. So either we all get like spontaneous mutations every generation, or there's a family history there that we're just not talking about. And one of the things that I think is important when asking for family history in Asian patients is to listen for, not make it just, is there a family history of depression? Is there a family history of suicide? But to ask about if there were accidental deaths. If you're asking about mania, ask about someone who shirked their responsibilities, ran off with the money, was excessively this or that, had a problem with gambling, things like that. And then one example for suicide, and this is a true example, was when I asked about suicide, and I try to ask with everyone in the room. And when I asked about suicide and they said no before I even finished the question, is there any family history of no? It's like, oh, okay, that's interesting. And then I looked at, everyone was looking at each other. And so I said, why is everyone looking at each other? And someone finally said, Grandma fell in the well. And I was thinking, the well doesn't move around, and it's where the well is. And so the idea that she had accidentally fallen in the well, I think was actually a suicide.
Right.
So these are a lot of times I do have to address the stigma with Asian American patients and emphasize that the brain is part of the body and that there's no health without mental health.
Absolutely. Yeah. Thank you so much for sharing that with us. My next question takes me to more of the recent events. And prior to the most recently reported acts of violence against Asian Americans, can you share your thoughts on the extent of this violence and where it comes from? What types of events may have been leading up to this?
There's a history going way back, and then there's the recent history. The history including Japanese internment camps and the Chinese Exclusion Act and the railroads and so forth, that goes way back, and there can be sort of upswellings when things are happening. The Japanese internment camps are interesting in that I didn't get taught about them in high school. I only found out about them later. And I remember asking my mom about them, and she said, oh, that was the Japanese. That wasn't us. We're Chinese. And that didn't sit right with me even back then. And as things like this happen in different communities, I think it's important to realize when people are being othered. I'm using other as a verb, when people are being considered less than or deserving of it or so forth. And it's important to realize that when the Japanese Americans were interned and taken from their homes and forced to live in converted horse stalls in the desert. Okay, so the U.S. was at war with Japan, but a lot of these people who were interned had never been to Japan, had never seen Japan. And the U.S. was also at war with Germany, and German Americans were not rounded up and put into camps, and Italian Americans weren't rounded up and put into camps. There was not the same sort of thing. And obviously, people being rounded up and put into camps has echoes of Nazi Germany. So anytime people are being othered, I think it's important to be aware of it. And we'll talk a little bit more about this when we talk about specifically what to do now. So this goes way back. So now flash forward with those who are ignorant of history are condemned to repeat it. So that's a little bit of the previous history. And then the recent history includes a former president who used words like kung flu, and even more than just the choice of the words on the printed page, listening to his voice when he said, the virus comes from China. It comes from China. That's the voice of every schoolyard bully that I've ever encountered for this and for other things. So this was very much scapegoating. It was deliberate and very hateful scapegoating. And then with the coronavirus and the pandemic, there was this rush to scapegoat it for someone, saying, I don't have to repeat all of the things, but,
right.
And again, saying that it was very much an othering of people. There was also in Europe outbreaks in Italy, and I have a friend who's Uruguayan and pointed out that every single case in Uruguay, which is a small country, stemmed from a woman who had been to Italy and then went to a wedding and was probably a very lovable, huggable person, because immediately 200 people came down with COVID from this one woman. But there wasn't this idea that Italian Uruguayans needed to be beaten up or killed. It was unfortunate that this one woman could be traced to the outbreak, and she, of course, felt terrible. But there wasn't the same sort of racial discrimination. So those things really added to this current uptick. And then the murders of the spa workers in Atlanta was part of, I think, a long history of the sexualization and objectification, fetishizing of Asian women. And we can talk more about that.
Okay. Wow. Yeah, I think it's good to really raise awareness about what was going on before these things, because oftentimes if people aren't paying attention, they tend to not even realize there's a problem until you see these horrible things on the news, and that's what we're trying to avoid. We're trying to raise awareness long before things escalate to that extent.
Another thing that I think adds to the easy targeting of Asians, I think more than, say, Italian Americans or German Americans or so forth, is that we are identifiable, that our racial characteristics are identifiable. And so we're easily othered if we have been in the country for generations. And then I think another thing that adds to it is that we've been taught to be silent for generations. And so there's a sense by someone who might feel predatory that we're sitting ducks, that we could be targeted easily. There's a sense that we won't report it. And I think historically, some of that has been true, that some of the shop owners in Chinatown, in San Francisco, and in Oakland had been saying that some of this had been going on for a long time, worse during the pandemic, but that they didn't want to report it. And then there's systemic issues with that too, because when there was a uprise in violence against Asians, some of the Asian American reporters were told not to cover these stories because they would be biased. With the Atlanta spa murders, there was a lot of attention about the shooter, about the murderer, but very little about the murder victims. At first, their names weren't even known, and they were identified as sex workers. And I've been collecting stories about who they are and so forth. One of them was a grandmother who had been married for 50 years and liked Zumba and Justin Bieber and gardening. And she could have been anyone's grandma, but she was labeled as a sex worker. Not that sex workers should be murdered either, but there was an immediate distancing of them, an othering of them.
Right.
and in some ways a scapegoating, which obviously the perpetrator had talked about being a sex addict, which is just ridiculous. That I'm gonna use Italian analogies a lot because I speak Italian and I love Italy, and I've found much more kinship and empathy from, I think, the Italian community in a lot of these instances when people are saying the pandemic came from China and so forth. And I think the Italian community has been more understanding in some ways than the general community. But if someone said, I'm a food addict, so I'm going to go first to one Italian restaurant and kill everybody there, customer, chefs, and then go to another Italian restaurant and go to another pizzeria and kill people one after another. No one would say he was having a bad day. No one would say, oh, he has a problem with food, so it's okay to go around killing people. It's not. It wouldn't be considered a rational excuse.
And this is something I definitely want to touch on more in a later question because it is something that is very disturbing, but it seems to fit the type of profile that we tend to see from many mass shooters, is this sort of persecutory worldview and blaming others, which is very dangerous, I think. So I'd love to come back to that. And I really appreciate that you touched on a little bit on the pandemic and what had been said in the news and the sort of negative attitude. It takes me to my next question, which is, did the pandemic have negative consequences on the attitudes toward Asian Americans, basically for the reasons that you stated before, where there was this sort of blaming or scapegoating? How did this begin to manifest and unfold?
I think that a lot of blame should be put towards the country's leadership at the time. But I also think that on the day-to-day level, a lot of people were so frustrated with this awful, fatal, contagious virus that they wanted to scapegoat someone. And scapegoating is an understandable impulse. Othering is a very understandable impulse, but it's not helpful. It's harmful. But I think as we talk about what to do now, I think one important thing is to realize when we have these impulses and have some insight on them rather than denying that they're there and rather than acting on those impulses. Early in the pandemic, I had a few situations that were obviously not being shot and murdered, but I did have some instances where I started, wow, this is interesting. Before lockdown, I traveled and a little bit after, I had a work-related flight where I had to go to Florida, and I felt treated very differently for being Asian. I saw people not go near me, go for a bubble around me. Early on, there was I don't know if you fly Southwest, but everybody piles up in this line. It's open seating, and so people come up when it's like A, 1 through 30 and 31 through 60. And I remember getting into my spot, and usually there would be people piled up on top of me trying to get into that line, and there was this clear bubble all around me. I thought, that's interesting. And when I went to get coffee, there were 4 employees, and they all of a sudden got they had served the person right in front of me who wasn't Asian. And then as I came up to the counter, 4 of them became very busy polishing the counter, restocking the shelf, and then giving each other dirty looks like, you go serve her. No, you go serve her kind of thing. And it was very obvious. I wish I had it on video. And people will say, do you know it was because you were Asian? And then another thing, so this was at the hospital, people, I think everybody really worked hard and were good. But I remember going to a meeting at the executive boardroom of the hospital, and there was this volunteer, an older white man stationed as the sort of information gatherer. And this was like a newly constructed thing at the hospital. So I asked about the executive boardroom, and he had just been chatting with someone who was asking for random directions, but who wasn't Asian. And so I stepped up, and I must say, I was wearing my name tag and beautifully dressed and not coughing or anything, but I stepped up, and he took 2 steps back from his little desk, so that he was out of breathing range. And I asked for the executive boardroom, and he said, "You can't go there." And then he paused and said, "Unless you're invited." I said, "I am. I'm one of the associate deans. That's a meeting that I am supposed to be at." So afterwards, I said very nicely to the volunteer organizer, not to fire him or anything, but just a little bit of education or so forth. So that was clearly pandemic related. And as we talk about these, there's all the things that happen and that you witness. And then there's things that you avoid because you're scared.
What was the timeline of those occurrences? Was that sort of in the beginning of the pandemic, or was that long after? I'm trying to get
that was at the beginning of the pandemic.
Okay.
Yeah.
Okay.
And there were some things before lockdown that I think the Asian community was asking to be addressed and hadn't been addressed yet. And then with lockdown, some of these things became different. So there was a guy on a bicycle, a white man, who just rode around Stanford campus shouting anti-Asian things and at students, at little kids, at families. Stanford was a very popular place for tour buses to visit. It was like a must-see destination for a lot of visitors from Asian countries and then families. We're very proud of being a beautiful university that attracts people from all over. And my husband and I would joke when we would see these families bringing small children to tour the campus and say, okay, so this is where you want to go when you grow up. And that's a whole nother topic about the whole academic pressure and so forth. But then for this guy to be biking around, shouting things at people, the intent there is clearly to make those children and those families afraid and feel like they don't belong on the campus, or maybe don't belong anywhere.
And no one reported this man? No one did anything to stop him?
Well, people reported him. There was a whole thing happening with the Asian Staff Forum and so forth, and trying to catch him. Okay. He was on a bike and he was dressed blandly, and he would, I think, target people on foot. So hard to run after him. And I encountered him at least one time, and I couldn't whip out my cell phone fast enough to capture his picture. Last I checked, he hadn't been caught. When lockdown happened, then I think there was a lot less reports of him. So as far as I know, he's still out there. Maybe he can get educated.
Wow. That's crazy. Let's discuss cultural competency with respect to clinicians, just in general. And I know that you've spoken on this topic a lot. What are some of the lessons that you'd share with us today in lieu of recent events when it comes to cultural competency and mental health?
Yeah. So the phrase cultural competency is, I think, evolving more into things like culturally informed care. I think one term that a lot of people like is cultural humility, just because cultural competency sort of implies that you get to a spot and then you're like fine, that it's an arrived goal. But if we talk about culturally informed care, it's not only being aware of what you know and don't know, which I think is why some people really like the term cultural humility more, and being open to hearing more about it. I sometimes talk about the golden rule with a twist, because I'll talk to people, whether it's gender, sexual, or race, ethnicity issues, and people will apply the golden rule, do unto others as you would have them do unto you. And they say, oh, I wouldn't mind if someone gave me a back rub at my desk. I wouldn't mind if somebody asked me to lunch, especially if that person were cute, things like that. Or I wouldn't mind if people asked me where I'm from. I'm proud of my heritage. They were perhaps not rounding up your group, and they're perhaps not knocking down your grandma or shooting you. So the golden rule with a twist is do unto others as you would have them do unto you if you were in their shoes. And that's where cultural humility, culturally informed care comes into. You often don't know what their shoes are like, and you might feel defensive about that at first because it feels like, oh, wait, you're saying I'm ignorant. That sounds terrible. But of course, there are things that we don't know about, and that doesn't mean you're a bad person, but try to be open to feeling what that's about. And my own husband is not Asian. And so there's been plenty of times I've had to explain to him when he says, oh, when I was young, I was fat and people made fun of me. And I said, yes, but it wasn't your entire family. And they didn't want you to go away and never see you again. That's a very different feeling to it. So cultural humility includes if you haven't been pulled over by the cops, and I haven't been pulled over by the cops, and to be grateful for the privileges that you have, but also to understand that's a privilege and that that you have to learn about things that have happened to your patients, your friends, and to do something about that.
What role has the media and social media played in exacerbating this situation or in spreading awareness? Do you feel like it's done more harm than good, or more good than perhaps bad?
Right. It does both, doesn't it? And especially during the pandemic, all we have is virtual communication.
Right.
So I don't know if you can measure good versus bad, because it's there and the genie's out of the bottle. We're not going to stop media and social media. So we have to be part of it, and we have to, I think, use it wisely. All we have these days is virtual communication. So I actually think that this might be a turning point for a lot of anti-racism efforts. George Floyd's murder, I think, had such an impact because we could all see a man dying in front of our eyes and calling for his mother.
Yeah.
And I think anyone who until then could say, oh, he was whatever, passing a $20 bill. Breonna Taylor was in her home, but then it was like, oh, she had a sketchy boyfriend or something like that. Wait, what? I think that so many of the previous people and names were forgotten because they were not caught on camera.
Right.
And so this time we're watching a man die. And that, I think, spoke to all of us. And so I think that this time, with old people being shoved to the sidewalk, some of that was captured on camera. Right. It was witnessed. And that's something that we can all do, is to witness and not look away, and to pay attention and to hear people's voices. So media plays a powerful role. And some people worry that it can normalize this type of...
Right.
And I hear that, but it depends on the perspective. If it's normalizing, if it's saying a lot of people are mad at this group of people and they should be, and it's fine for them to do it, then that would be normalizing. But I think if you pay attention to the voices of the victims and the harm that it causes. So the first article that I read that had the names of the spa workers, the grandma, it said the family can't be reached for comment. And then a while later, the family said, we've been taught in Korea to grieve in silence, but we're not going to do that anymore. And so they had pictures, they had reminiscences, and definitely she was anyone's grandma. And I think that's the kind of media that should be out there, is to talk about the harm that can be done and what can be done differently. I think a very important part of the article about Suncha Kim was the number of non-Asian people in the community who talked about what a good friend she was and what a wonderful person she was. And so whatever attempts to normalize the killer is then balanced by all of the friends and community members who said this was a person and this person should not have died. So I think media can be so helpful. And so I think we need to use it.
In a positive way, right?
In a positive way. That's right.
Yeah, absolutely. And with the Atlanta shootings, the shooter seems to fit, as I was mentioning before, the profile of most mass shooters. We had Dr. James Knoll speak for us at our Forensics Academy, and he talked about this sort of persecutory worldview and this victim mentality that many mass shooters tend to have. And it seems as if it's taken to this extreme. And in this case, as you mentioned, the focus was on this self-proclaimed addiction that this person said he had, that he then blamed others for. And then you have race involved in that. So how does this unhealthy and dangerous way of thinking become even more extremely dangerous once race is involved? Can you share your thoughts with us on that, especially when it comes to this case? And I don't want to give too much attention to the shooter. Like you said, we should be remembering the victims, but I do want to raise awareness about how dangerous this can be.
Yeah, I'm not going to focus on the shooter, but on the overall sort of mentality. Blaming other people for what's not gone well in your own life, that's a defense mechanism, and it's a very unhelpful defense mechanism, but that happens. Access to firearms is obviously something that someone who's aggrieved and doesn't have access to firearms can only do so much harm at one time. And then, as you said, when race becomes involved, then everyone from that group is guilty from that person's point of view. That's the danger of race being involved. Because if I were to blame, I don't know, grocery workers for spreading the pandemic or so forth, then I could perhaps avoid grocers and have food delivered or something. It still wouldn't be rational. But when race is involved, then everybody, elderly people and small children and everyone from that group becomes guilty. And that's very dangerous. Mm-hmm. It's very unfair and it's very dangerous.
And it seemed in this case, it was at least race and gender. It was women and race. It's so awful. Now, how did these attacks actually affect mental health in the Asian American community? And I love that you shared with us a little glimpse into what might be culturally different than the way that many people might grieve, that within the Asian culture, there's an emphasis on more privacy. Is there anything that you can share with us about how these attacks affected this community and what was their response? How did they cope?
The response has included a lot of different responses, sometimes all in one day. Anger, of course, and sadness, and a sense of isolation and loneliness, and a sense of not belonging, and sometimes a sense of hopelessness. Since at Stanford, we're near a lot of companies in Silicon Valley. I've been talking for a number of the companies that have a lot of Asian workforce, and that's been helpful. And what I keep hearing over and over again is how much they feel like their concerns, their experiences weren't taken seriously in the past by people in general, not necessarily by their companies, or sometimes by individuals, sometimes by groups. And then in the community as a whole, it affects people so profoundly in so many ways. A reporter for the Washington Post, Marion Liu, has been looking at this nationally, and so she could probably tell you more on a national level. But it includes things that have actually happened, but it also includes all of the things that you don't do because you're afraid. And this is what I keep hearing, not just from patients, but from friends and neighbors, is not going out and doing the things that they had wanted to do. And this is the sort of damage that you can't even measure. And it's a real tragedy.
Yeah, absolutely. Absolutely. So what can people do now?
I love that question. I have 3 categories of things to do now, and I group them as recommendations if you've experienced something, and that can be a microaggression or violence. Recommendations if you've done something, and then perhaps the most applicable recommendations for bystanders. So starting with recommendations if you've experienced something, don't ignore it. Don't feel bad for feeling bad. I think that this is something that is very much a part of the Asian community. Like even after the murders in Atlanta, I got one of those free papers that I think only myself and my Asian neighbors get. And it has advertisements for acupuncture and herbal things and so forth. And it had an article that said anger and frustration will back up in your liver and I don't know, block your chi. And it was really like, first of all, that's scientifically inaccurate. And second of all, anger and frustration, they exist. Pain actually protects us. And so recognizing that having something happen feels awful and insensitivity to physical pain is a dangerous neurological condition, that people lose fingers and toes if they can't feel pain. And insensitivity to mental pain is also dangerous. And since we're doing a podcast, you can't see that I'm wearing a string of pearls. And in the center of every pearl is pain. And without pain, there would be no pearls. There would only be injured oysters.
Wow. I love that.
Yeah, you can put that on a t-shirt if you want. So the first thing is to even recognize it and then talk with someone and get allies. Don't be alone. Don't be invisible. There's the traditional fight or flight response. Adrenaline has to go somewhere. You can't just bottle that up. So fight or flight or flock. Sometimes you can fight back and don't harm yourself, don't harm other people. I do like the video of the grandma who fought back. And so, yeah, when I was traveling on a train in Italy and someone tried to stick his hand up my skirt, I did hit him in the face. And then he left the compartment and came back with a 6-pack of soda and gave one to everybody in the compartment. And when the guy in the corner away from this guy got up and left, he shook my hand very warmly and said in Italian, "It's been a pleasure traveling with you." So I'm not going to tell everybody to go out and hit everybody in the face. Don't do so preemptively. Right. But I also think that not only did the one who tried to stick his hand up my skirt maybe not do that again with another Asian woman, but the other men in the compartment saw that and were like, all right, I think that was good. So fight sometimes when you have to. Flight, don't all move away. My daughter asked about that at some point, and I said, I have worked too hard for this country, and I was born here, and this is my home. But also, you've seen my pictures before where I was a lieutenant commander in the U.S. Public Health Service and all that kind of stuff. I deserve to be here more than the people who are going around killing people. I totally do. So I'm not fleeing, but flocking. So within your community and also with a flock across groups. We are social animals, and I'm speaking to all of the Asians. There's not enough of us to not only flock only within the group, we also need to flock across groups. We need to be allies and upstanders for other people who are being persecuted, and we need to stand up for ourselves, and we can't other people within the group. So the thing about this being Asian women, I've had fairly sexist things said to me by members of my own group, members of my own family.
Right.
And so do flock. If you've experienced something, remember that having multiple factors doesn't mean that you imagined it, but it does give you perspective. So if part of it was racism and part of it was something else, it doesn't mean you imagined the part that was racist. If it's, the reason somebody did this was you were in the wrong place in the wrong time. You could look at whether that is the wrong place at the wrong time as well. And then definitely permission to pick it up and put it down. The Kubler-Ross stages of death and dying, outcry, denial, bargaining, depression, acceptance, action. You can have more than one of these stages at a time, and you can go through them. And then most importantly, you and your family or friends can be in different stages. And so I've seen this in psychiatry with diagnoses of autism and schizophrenia and so forth, that one family member will be furiously looking up everything, and the other one will be sort of like, I don't know why she's looking up everything. She's completely lost it. And then the one who's looking up everything will be sort of like, well, he obviously doesn't love this person as much as I do, because one person's in denial and one person is in outcry or bargaining. So it also applies to things like this, violence and discrimination. You'll have somebody saying, oh, you imagined it, or they'll be in denial. And to sort of realize that and not let that tear each other apart.
Right.
So recommendations if you experience something, that's obviously painful. Recommendations if you've done something is, I think, even more painful.
Right.
But I do want to emphasize not only that this is obviously a mixed group, Asian and not Asian, But also we, whether it's Asians or women or whatever, any group that I'm part of, can also perpetrate microaggressions on other people and on our own groups. As I said, I've had some fairly sexist things said by Asian people, including this aspect of Asian women being fetishized. So I've had non-Asian women tell me, oh, I'd love to be considered sexy all the time, and not understanding that there's this very hostile edge to it. Right. And then for Asian men, my brothers were sort of like, well, you're getting dates all the time. It sucks not getting dates. And it does suck not getting dates, but the sort of scary, possessive nature of being fetishized was something that I think they didn't appreciate. And even like little examples, like my dad was a university professor and I had to tell him to stop using the term co-ed. And this is one of those things where I wouldn't mind being called a co-ed. It's implying that men are educated and women are on the side, that we're like an afterthought. And if you've done something, I like to think that if my 90-year-old father can evolve, all of us can. So if someone has told you that you've done something, start by listening to what the other person experienced. And this is very difficult, but try to do so without being defensive. And obviously, if there's more than one person, you need to really, really listen, because if there's two examples, there's probably more. And to realize that if your automatic assumption is, I'm not a racist, I'm not a sexist person, that these are actions and not like an immutable character trait. So the defense of saying, I'm not racist because my family didn't own slaves, or I'm not a racist because fill in the blank. Look at this action and whether it hurts someone. So,
right.
Intent matters, but impact matters more. You would apologize if you dropped a book on somebody's toes, right? You'd apologize, even if it wasn't intentional. And you wouldn't say your toes were in the way, or you have very long toes. Why weren't you wearing hard-toed shoes? You don't do that. So if you've been accused of something that hurt somebody, you should apologize genuinely and not say you took it the wrong way or you were too sensitive. And then also don't expect immediate absolution. You should apologize, and that's what you should do, and then learn from it and learn from mistakes and try to treat it as a gift if you can. But their job is not to forgive you right away. So the sort of thing where someone says, oh, I'm so sorry. Are we good? Are we good? That's, I think, the best way to apologize.
Right.
And I'd like to quote Maya Angelou here. Do the best you can until better. And then when you know better, do better.
Oh, I like that. That's a very powerful quote. I think that really touches on the importance of what's going on, and that sometimes in social relationships, people want to quickly resolve or think that everything is okay, but that's not honoring the nature of what's going on. And that's not truly growing and learning from the mistakes and the experiences.
Right.
So
hopefully we aren't saying or doing insensitive things very often, but I think we witness it often. And even during this time of pandemic, we can witness it in Zoom rooms, and we can witness it in line at the grocery store. So the very first rule is to listen and witness and don't look away. And there's, I think, the group called Hollaback that has like the 5 Ds of being an upstander. And what's important to know is that there's not just one option. There's direct, distract, delay, delegate, and document. And so direct is something that is difficult. So you might not be able to do this. So if you're in a meeting or, I don't know, in line at the grocery store and you see something happening, you could be direct to the perpetrator and say, that's not fair, or give her some room. That sort of thing. Mm-hmm. That's probably the most difficult. Easier, especially if the perpetrator is in a position of power or bigger than you, you can distract. And there's wonderful suggestions that the upstander training people have. So in a meeting, it could be like, hey, I just remembered something. And in a street situation, dropping your change, dropping your water bottle. If there's somebody on the corner or across the street, you could ask for directions. If you're the same ethnicity as the person who's being picked on, then you could pretend to know them. And so come up, it's like, hey, Nine, sorry I'm late. And then get the victim away from the aggressor.
Mm-hmm.
So that's distracting. And then delegating. So let's talk with your supervisor, or let's go to customer service. Let's report this to, I don't know. I had something happen in a theme park, and it would have been lovely if one of the families who witnessed it went up to the theme park employee and said, hey, that family is getting picked on. Those kids are being picked on. And then delay. If you can't do something in front of the perpetrator, if you check in later with the victim and say, I saw that. Are you okay? And then if you are in a position of power, you could check in with the perpetrator later and say, I think that came across badly. And remember that if you are friends with the perpetrator, helping them evolve is not getting them into trouble, it's getting them out of trouble. So being able to say was doing their best and there wasn't really any good by making fun of them or things like that.
Right.
So document. So many of these things we would not have known about if there wasn't a witness. So if you're a victim and you can reach out and get something documented, that's great. But more of the time, it's going to be an upstander who sees it on the cell phone and is able to step forward and say, I saw this happen. And obviously, if you've had someone help you out and be your ally, to be able to pay it forward.
Absolutely. These are all such great tips. Is there anything final that you'd like to leave us with? I feel like you shared so much helpful information, and this has just been so wonderful talking with you.
I so appreciate the chance to talk with you and to reach people on the podcast. Hi, everyone. Don't be alone. Help yourself and help others.
Absolutely. And that's what we hope this podcast will do, is just spread awareness, and we'll be able to help each other. Thank you so much, Dr. Hu.
Thank you so much, Sabrina.
This episode was brought to you by NEI Membership. The 2021 NEI Synapse Virtual Half-Day Series is included with NEI Membership. Become a member today so that you can register for free for any or all of the monthly half-days, in which Dr. Stahl and colleagues will spend the last Saturday morning of each month sharing cutting-edge research and clinical insights on the topics most relevant to real-world practice. Don't miss out. Become a member today. Visit www.neiglobal.com to learn more.